This is One-on-One. We're speaking with Dr. Lauren Strober with Kessler Foundation, also research assistant professor, Rutgers, New Jersey Medical School. Doctor, describe your research here at the foundation, particularly as it relates to MS.
So I have two avenues of research. The primary one looks at employment and outcomes and quality of life. And the second is actually on secondary complications associated with MS. Things such as depression, fatigue, sleep disturbance, personality changes, things that are not commonly thought of in MS, but actually are quite debilitating and pretty common.
Talk about the depression connection.
So depression is much more prevalent. About 50% of MS patients report an incidence of depression during their lifetime. It's much higher compared to the general population as well as other medical conditions. So we know that it's a significant problem. It's both directly related to the illness, but more so related to psychological factors, such as coping and cognitive impairment and social support, perceived lack of social support in particular, all relate to depression and MS.
Let's try to break this down for folks, because I don't know what most people think when they try to imagine or think about someone dealing with MS, or you know someone dealing with MS, or someone watching right now has MS. But try to describe for folks, because you have so much experience dealing with patients with MS, what they are facing and how it could manifest itself in someone who ultimately winds up dealing with depression.
Right. Well, I think the biggest factor about MS, at this point, there's no cure. We don't know exactly what causes it, and it's a variable and very unpredictable disease. So you don't know, perhaps if you'll be disabled and in a wheelchair in 20 years or maybe 5 years. So I think that's the biggest part. It's that sense of locus of control, what we call, or perceived ability to manage an illness and feel like we can exert some behavior change or some control over an illness. MS is not that type of illness. It's not something that we can see a marker and say, oh, it's coming down or it's getting better, and perceive what's going to happen in the future. So I think that depression, a lot of times, is that uncertainty, the perceived uncertainty or lack of control over the illness that you have.
What about for family members? Have you interacted with family members who, they are trying to be there for family members with MS, and you're talking about this loss of control. What about for family members?
Well, certainly they could feel the similar loss of control and uncertainty about their future as well with this partner. It's interesting that we think of caregiver burden much more often with elderly patients. So most of the research to date has been among people who are older, who are dealing with Alzheimer's or dementia and that burden. Only in the, past decade have people really given more attention to sort of the younger counterparts, people with MS who are in their 30s, 40s, getting diagnosed, and maybe they're just starting off their life and making family decisions and work decisions, and that really affects their spouse or their partner. But only recently have we really started paying attention to what that impact has on their life and their perceived future and uncertainty as well. So it's slowly becoming aware. Certainly depression, we know in healthy population as well, if your partner is depressed, has a huge significant impact on you. It can lead to you having greater depression as well. So overall, I would say depression is a global, it's not just a patient, it affects the whole family, their partner, their children, their parents, everybody.
The other area that I want to talk about, and you did a study involving 107 employed individuals with MS, right? Tell us about that, because then I want to ask you a little bit about sleep-related issues. Talk about the study itself.
So that was actually a really neat study. It's a follow-up study that I did probably nearly a decade ago. So we know that fatigue is a debilitating problem in MS. It's probably the most frequent problem and the most detrimental to one's being that we know of. Up to 97% of patients will complain of fatigue at any time. To date, we always looked at things such as the disease itself causing fatigue, as well as depression actually being a leading cause. Intuitively, one would think, well, what about sleep? Because I would think if I have sleepiness, right, or fatigue during the day, it may be very well attributed to how well I'm sleeping. No one's really looked at it. It started in the early 90s, people paid attention to it, and then it kind of drifted off. So we did this study about a decade ago. We showed that actually sleep disturbance was the #1 predictor of fatigue in MS. And we replicated that in 10 years later, similar findings in a larger sample, same exact thing. Disease does contribute, depression a little bit, but the #1 factor that said why somebody might be experiencing fatigue was sleep disturbance. And that could be attributed to many things such as depression. and worrying, but also to the physical symptoms of MS. So there's sort of this trifecta of symptoms. So getting up to use the bathroom, bladder incontinence, or muscle stiffness, leg spasms, those all contribute to somebody getting up and having poor sleep, that while it's directly related to the illness, it indirectly, through their sleep disturbance, causes them to have greater fatigue.
Let me ask you this, Doctor, in light of, or in spite of, everything you just laid out, the challenges, the difficulties, these so-called secondary complications for patients with MS, are there in fact reasons to be hopeful and optimistic as it relates to the MS research right now?
Oh, I would hope so, for sure. There's great hope, and I think is more important than our research. I mean, we do research every day that I think leads to great hope. But I would say the more important thing is for our patients to have hope. And in fact, things such as resilience and extroversion and coping skills, and having a sense that some people even find meaning due to their MS or find purpose in life. They find it part of their narrative. It's part of a chapter that's going to go through their life, but it doesn't define them. But they lead it to kind of sense that life is still more meaningful, because you question things a little bit more, I think, too. So I think that our patients have a lot of hope, and I hope that we do enough research that can bring them hope to know that we are doing more, but that they're in their daily lives, that they are optimistic about MS and their own lives.
Thank you, Doctor.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Delta Dental of New Jersey, the Healthcare Foundation of New Jersey, NJIT, the New Jersey Reentry Corporation, New Jersey State Nurses Association and the Institute for Nursing, New Jersey Sharing Network, and by Community Food Bank of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.